So I'm really pleased to introduce our keynote speaker, Dr. Joshua Rosenthal. Dr. Rosenthal is a senior scientist at the Division of Epidemiology and Population Studies at the John E. Fogarty International Center at National Institute of Health. Dr. Rosenthal earned his PhD in botany and did his postdoctoral research in entomology, both from UC Berkeley. Dr. Rosenthal's previous roles in the Fogarty Center include the director of the Division of International Training and Research, and he currently leads research in global environmental health with a principal focus on interventions to reduce the burden of diseases from household air pollution in low and middle income countries. He is also, importantly for this seminar, co-leader of the new initiative at NIH on climate change and human health. So please join me in welcoming Dr. Rosenthal.
Thank you, Dr. T. Arden and IDAC. It's a real pleasure to be here. And I'm sorry I'm not in the room to see many of you face to face, but I'm trying to walk the walk these days, and rather than travel for single day events, do as many of them online as possible. So this is consistent with the theme of my talk, which is on climate change and health. And what I will be sharing with you is some work that we have been developing at the NIH, and to put this in a bit of scientific context on what we understand the health effects to be, or likely to be, in many cases, from the ongoing and massive changes to our climate in the US and around the globe. Let me take a second to ask, are you looking at the right monitor? Do you all see just a screen, or do you see the,
yes, it's
okay.
fine.
Very good.
I'm just going to probably minimize, or let me see how we do this. This is better. I'll put you in the top right corner.
Okay, very good. Right, so, and I want to in particular thank you for asking me to participate on behalf of your Women's Global Health Research Center, as women are central to the climate change and health discussion, and both because of their particular vulnerabilities and because women are central to solutions. A bit of background for many of you. As probably most know, the increasing alarm in the global community around the trajectory of our climate has reached somewhat of a crescendo last year with the Intergovernmental Panel's on Climate Change's report that basically was titled A Code Red for Humanity, at least termed that way by many, including the UN Secretary General. And this is based on projections for the trajectory now for climate change, our emissions of greenhouse warming gases in the future, and both the current and likely effects that are of extreme weather, as well as chronic long-term changes that will have a profound influence on human health and well-being. If you look in the upper left-hand corner, just as a reminder to some of you who weren't trying to assemble all these events in your head as you read about them in the news, but in 2021, we had a record year for weather and climate-related disasters, from droughts and heat waves, flooding, extreme hail events, hurricanes, tornadoes, extreme precipitation, wildfires, and even some extreme cold events. These broke many records and are likely to just be part of the future we're all facing now. Just last week, the Journal of the Lancet, from their series, The Countdown on Health and Climate Change report, released their 2022 report titled "Health at the Mercy of Fossil Fuels." It's a long and dense report, and I've only made my way through about 2/3 of it so far. But the salient point here is that they see this their series as a call to action, and that what we really need now is an immediate health-centered response to secure a future in which world populations can not only survive but thrive. And so I'm here to talk about some of those pieces. And I think what I'm going to do is first try to put the big picture of climate change and relationships to health in some context, and give you what we understand and have observed about health effects, and then come back to what we think is the research agenda going forward for it, at least as we're developing it currently. So if you see here, we have climate, which is a broad range of long-term, multi-year changes related to temperature. It also influences extreme weather events, precipitation, sea level rise, and interact with human interactions with the landscape that are also influencing our land use patterns and ability to grow crops. These effects then turn more into a series of more proximate events, and through variety of both weather and human actions related. And through those, we experience both direct and indirect health impacts across most of the range of mostly known health effects, in most cases making them more serious, more widespread to people, especially more vulnerable populations. And where we want to go is to anticipate this, develop strategies and interventions to mitigate those changes in the landscape and their effect on health, and perhaps even to mitigate climate, at least understand what the health effects are of climate mitigation actions. But to do that, we have to understand the importance of context for these determinants. Social, economic, and environmental context is hugely important to how climate is felt, from access to healthcare, poverty, population densities, environmental exposures, infrastructure, and even very local geography. Mediate, mitigate, or exacerbate the health risks at every juncture. So what we're doing now at NIH is establishing an initiative that is agency-wide. We have active participation from about 18, 19 of the 27 institutes already. And we are led by a group of 7 institute directors, and I co-chair with my colleague at NIHS, Audrey Miller, a working group of 145 professional staff across both the extramural grants, policy realm, as well as our intramural researchers. And the broadscape are walking into this, our objectives have been to identify the risks and develop a research agenda that will optimize the benefits to health from actions to either mitigate or adapt to climate change. To develop the necessary infrastructure, both research and workforce infrastructure, so that we can draw not only on all the young people that we will need to carry this forward in the future, but also the wide range of disciplines that this very complex area requires. And this involves partnerships with many agencies, other funding groups, many disciplines, scientific, professional societies. It's an all hands on deck situation I think we're facing. To do this well, we will need to be quite innovative, and everything from basic research, but also to very downstream translational dissemination research that can be actionable to protect health. With those sort of basic criteria in mind and the complex interactions that I've started out describing, our strategic framework, recently released, involves a series of philosophical, procedural, scientific, and insights to create what we think is necessary. And that is, if you look in the center of this cogwheel, a transdisciplinary transformative research program that is, its underpinnings and its core pillars, if you will, are health effects research, health equity, training and capacity building, with an eye especially to intervention science. This will and is necessarily depends on partnerships, interagency and community partnerships, as I mentioned, and will employ a wide range of scientific research areas. If you look around the outside cogs, everything from studies on adaptation agenda and basic research through behavioral, disaster research, implementation science, predictive modeling, risk assessment, and systems modeling. The entire text is available on our website, and please go to look at that if you have more details. Let's step back a little bit to what we think the health effects are likely to be. And we're categorizing generally in two buckets. Direct effects being things like heat-related illness, respiratory diseases, heart disease, food and water-borne and vector-borne disease, injuries, premature death, mental health impacts, and poor maternal and child health. And then there's a group of very complex indirect effects that take place through interactions of climate with the socioeconomic infrastructure, including healthcare and supply chains, things you're hearing a lot about these days, and importantly, poverty and socio-environmental interactions. And that's because, in part, climate change affects us all in different ways. And there are populations amongst us that require particular close attention, including underserved populations, those with historical health disparities, workers that, especially those that work outside, but others in relevant occupations have high vulnerabilities. People with disabilities are vulnerable because they're always vulnerable, and they have particular climate-related vulnerabilities. Different life stages, in particular, the very young and the very old, and pregnant women are especially vulnerable. And then those with special medical conditions also have particular vulnerabilities I'll talk about a little bit more. And then finally, those in low and middle income countries that are already suffering a wider and greater degree of existing diseases, malnutrition, and extreme poverty. But let's bring this back a little bit closer to home for those of you in Indiana. What you're looking at here is a map I downloaded from a recent publication on work adaptations to address the heat risks for agricultural workers in the U.S. In the upper figure A, this is basically a heat map of the United States, and with projections, measurements of heat indices and risk population, a fairly fine stage. They have mapped those populations that are at various levels of risk. That little square is approximately, if I've got it right, where Purdue sits, Indiana. And according to this map, Indiana, especially agricultural workers, are probably in the low to moderate and risks today. Under the 2-degree warming scenario, which we are aiming for, but not really achieving based on their emissions trajectories of the last decade, and by mid-century, the picture will look more like that in B, where those in Indiana will be more likely experiencing moderate and high risks, and a few even events in very high extreme risk scenarios. Where we're more likely going, that's B, which you just saw above. I've just lifted the figure up to show you what happens under a 4-degree warming scenario, which is right now we are somewhere between the 4-degree scenario that's projected out to the end of the century, but projected back to mid-century, we're looking at very high and extreme risk for agricultural workers, including in Indiana, by the mid-century. So this is a women's health research symposium, so I'm really pleased to have the opportunity to talk a little bit and to think a little bit with you all about how women's health has particular needs and particular vulnerabilities. Here's a list of exposures on the left-hand side, and the associated physiologic, biologic, and in some cases behaviorally related vulnerabilities that we think create, and there is evidence for in most cases, disparate health impacts by women. Extreme heat through poor air quality, disaster-related complications, food insecurity, waterborne diseases, and vector-borne diseases. I won't try to go through this in detail here, but we'll leave it for you to take a look at for a second and see if any of this resonates with your experience or knowledge. This is, of course, based not only on biological and in some cases behavioral vulnerabilities, but also relate to the social and cultural and political inequities that limit women's choices and their capacity to respond. Women tend to have a critical role as a family caretaker, and during extreme events, that puts women front and center. They typically have less equal access to technology and resources, and in many countries, restrictions on land ownership, less education and lower pay, and in many places, and I won't speak for Indiana, but a less of a voice in decision-making at multiple levels, and also tend to have reduced access to healthcare, especially in low-income and low and middle-income countries. So I'm going to step back and talk a little about some of the science related to the direct effects of healthcare and climate, and we'll focus, especially but not exclusively, on some evidence related to women and in particular pregnancies. Several studies have now shown that, including a relatively recent study looking at 30 million births across the country. This is already from data from a couple of decades ago that showed that high ambient temperatures across the pregnancy create a higher probability of low birth weights and small for gestational age among children, especially in the second and third trimester, where heat effects tend to be more important. It also affects fertility in women, high temperatures, that is. And this is reflected in some recent work looking at the antral follicle count in women. It's not a huge sample size, but fairly compelling numbers that showed that daily ambient temperatures over a fairly short-term span produced a reduction in the ovarian reserve. And then, of course, pregnancy is a vulnerable time in general. And what we saw after Hurricane Harvey was a large increase in both maternal morbidity and neonatal morbidity. And that has been borne out by observational studies and other events where after extreme events, we do have higher cases of morbidity and in some cases of mortality from the after effects of the hurricane, not necessarily direct. And of course, those at lower socioeconomic status are most affected. Now, just so the men don't feel left out here, I want to point out that extreme heat has also been linked to increases in a wide range of mental health emergencies, from substance use disorders, anxiety and stress-related, mood disorders, schizophrenia, self-harm, and in children, onset disorders. And I mention the men because it appears, at least in this study this year in JAMA Psychiatry, that men tended to have a higher vulnerability to these kinds of events, probably related to other behavioral and biological pressures. Let's talk for a second about indirect effects. As I mentioned at the outset, climate change has a wide range of interactions, and I only have time to go through a couple of them here, but so I'll just point out one of the more obvious ones, and that is climate change disrupts clinical care. And as a result of damaged healthcare infrastructure, power outages, staffing shortages, transportation disruptions, many access to care components are either slowed down or obliterated, that overwhelm the health system's capacity. They also lose medical records and have real severe supply chain problems. And this is probably what was behind a difference in mortality in cancer victims after Hurricane Katrina. And that is by disrupting the cancer care continuum, including chemotherapy. There appear to have been effects on disproportionate effects on those undergoing care for cancer. Another interactive discussion around that is an indirect effect of that has a particular effect on women appears to be through the effect of climate change and air pollution, and how this affects maternal bone strength. Now, I say indirect because the relationship of air pollution is complex. It's multidimensional and multidirectional. And so for the purpose of simplicity here, we're just going to treat it as an indirect effect. But in fact, higher ambient particulate matter, that is a fine particulate matter, PM2.5, has been shown to be associated with lower bone strength in pregnant women in Mexico City. And what that looks like over the long run, we do not know. Does that then subsequently exacerbate osteoporosis and vulnerabilities to associated diseases in later life? To be studied further. Another indirect effect is in the way that hurricanes affect infrastructure, and in many ways. We know that after the hurricane near Manchester, hazardous waste was distributed far and wide, and these are likely to be the case in many disasters. Let me see. Similarly, wildfires have appear to have an effect, not only direct effects on people and via the associated air pollution, but on contamination of drinking water. If you look at the 2017 and 2018 major fires in California, now we've seen increased depositions of several serious pollutants listed here: benzene, vinyl chloride, toluene, etc., that are all known to be carcinogenic and have other toxic properties. So I want to spend just a minute or two talking about the health benefits and risks of climate actions. That is, of course, a major part of the discussion by the Lancet Countdown series and others. And we think it's important not only to understand what the benefits are from climate change, but also the risks from actions to mitigate climate. Here's just one example. I was fortunate enough to be at a conference in Utrecht, Amsterdam, in Holland a few years ago, and I was just stunned by the infrastructure for cycling and walking. Everywhere you go in the city, it's people are cycling much more than they cycle, they take automobiles or cars, even over pretty long distances. Now, it helps that it's flat, and they have very good infrastructure to do that, and they've made major investments. We know that active transportation has a really foundational role in cardiovascular and heart health for women and for all of us. And there are many, many studies that have made this very clear. So investments in moving people away from auto use, is likely to increase if you have safe infrastructure, clean air, and the days are not too hot. Good cardiovascular benefits. Some work from my own research in household air pollution actions in the developing world has shown, and many other studies are now coming out that validate this modeling exercise. But if you look here on the left, we're looking at transitioning homes across 40 countries in low and middle income countries to liquefied petroleum gas, still a fossil fuel, but relatively clean compared to biomass, wood, animal dung, crop residue, other things that people burned in relative open pits or relatively crude traditional cook stoves. And the good news is that as we transition to clean energy, which reduces the associated burden of disease, we also reduce greenhouse warming gases, especially if they are in an area where wood is coming from unsustainable harvesting. Green spaces and the time spent in green spaces has been an active area of research in recent years. And I have to admit, despite my intuitive belief in this and my perceptions, I approached this rather skeptically from the beginning, because it just seemed a little too fuzzy to be able to document scientifically. But the data is now overwhelming. There are study after study that show that, just to pick three here, green spaces reduce all-cause mortality in cities. This is a big European city study. Cancer patients living in areas of higher greenness, and that is maybe in an agricultural area, it doesn't mean the same thing it does to you in a city, but it still means open natural spaces, have lower risks of cancer mortality. And there's now recent evidence to show that it improves the mental health well-being and reduces behavioral disorders in children. And I will say that personally, that's my wife on the left and my older daughter on the side there. We have always felt that getting out into nature was a really foundational part of our well-being, and now happy to find that data is growing to support that as a scientific, there's scientific health benefits, scientifically validated health benefits. I want to point out that, well, as we transition and we begin to take actions more aggressively to reduce climate change, we have to keep in mind that some of those actions will pose risks for health too. And not everybody wants to talk about these, because we all want to see climate mitigated for lots of reasons. But to be scientifically honest, we need to be transparent about this, and we need to study to see what those are. But a couple of the obvious ones is that mining for batteries, a major component of solar and wind and renewable energy systems, it increases the release of toxics, and particularly for occupational, for miners. But what are we going to do with all those batteries? And they create toxic waste, and all the electronics surrounding those do as well. The photo on the right there, I took just a couple of weeks ago in Ghana at Agbogbloshie, the largest e-waste site in the world, where people and informal communities have grown up around salvaging what they can from all the e-waste that is accepted into Ghana from all over the world. What he's doing there is burning off the plastic and the rubber around wires, because the copper is of great value, as is aluminum, and to a lesser extent the iron. And the most efficient way that these people have is to burn it off. You can imagine what the health effects are of that. We have studies ongoing in that area. Nuclear energy is a transitional fuel, as an area that we're probably going to see increase, creates nuclear waste, and that merits a lot of attention. So how we do that carefully. Should also be clear that green spaces are important, but in some cases, increasing forest coverage may increase exposure to disease vectors. That's a complicated ecological dynamic that also relates to the type and the diversity of the mammals that are in those forest populations, the proximity to humans. But it's something that we need to pay attention to. And finally, poorly understood, but I think as it will be a growing area of research, is what the large-scale carbon sequestration projects that are in planning now what risks they may pose. And really, we don't understand this, but we have to assume there will be impacts, and we have to look at them carefully. So, as I said, there are both needs to adapt to climate, and there are needs to understand the health consequences of mitigation. What's also clear is that community participation is key to designing those strategies and to conducting them, to making them work. Fundamentally, the exposures are at a local level. Global phenomenon are felt by individuals and communities, and community actions are going to be one of our most important strategies of doing that, whether that means transitioning from fossil fuel plants to preparing for and rescuing folks after disasters. This requires all of us to look to the most vulnerable in our communities and design strategies to protect all of us, but especially them. And women have a key role here. Women are really the glue in many societies that hold communities together. They're the connectors, the educators, the caregivers, the leaders, the innovators, and agents of change, even not only in the US, but also in places that might be seen as much more traditional. This is a group of Ashas, or village health workers in India, that are collaborating with the project. And the person on the left in the sari there is an eminent scientist in India, Kalpana Balakrishnan, who is one of the world's leading air pollution experts. She is very keenly tuned in to what a critical role these village health workers and their links to families and the glue they provide in these communities are for both doing research, doing it well, identifying solutions that are of value to people, and they will follow through on to make things work. So just to step back now to the research agenda, there are a few kind of big picture areas that we think are really important. And they start with from left to right. Understanding what the new and emerging health risks are. I've described a few, but we're really at the early stages of this. Understanding who is most at risk beyond the very young, the elderly, and women, and those who are poorest. We need a little more resolution on that, and it will change place to place and condition to condition, context to context. What kinds of interventions are effective and safe? What are the predictive capabilities we need? What kinds of climate models will be helpful for us? How do we build a science that allows us to interact well with a climate research community, with weather researchers, with all the other disciplines and people that need to be involved? This is a complex and area that you'll see us spend a lot of time on in the next couple of years. As I mentioned, what are the health benefits or the costs that come with climate actions? And how can disaster warning systems best save lives or protect people more broadly? How do healthcare systems prepare for the challenges of providing adequate care? and how do communities best adapt to a changing climate? I won't discuss the research opportunities in any detail here, but I'm happy to answer questions that I can. We have, as I mentioned at the outset, developed a strategic framework, and we've issued a number of calls, still somewhat limited by the budget we have available to work on this. If the Congress smiles on us and follows through on the president's budget, we will have a significant chunk of money to really expand this strategically. But we will do everything that we are able to ensure that the research community is well supported to play a critical role in establishing the evidence base for our health and well-being in the context of this changing world. And I'll stop with that. Thank you.
Thank you, Dr. Rosenthal, for a really informative presentation. So I'd like to ask if anybody has any questions at this point.
We have one question from the chat about whether these wonderful slides would be made available because they would love to access the references.
There's a chat question about the slides being available, but the presentation will be available on our website, and it will be posted as soon as we can process it. We'll put it on the website. Anybody else? So I was a little surprised, I shouldn't be, by one of your statistics that you showed about the increased mortality or morbidity of women, maternal, after the hurricane, pretty significantly following the hurricane. And that I'm assuming that relationship must be due to stress hormones, or what would you say might underlie that relationship?
I think a lot of it has to do with access to medical services. I'm sure stress is a part of it, but also, think about the chaos that occurred after Katrina. There were regional wide effects that affected everything from telecommunications to roads to hospitals being open. So I'm sure there are physiological effects, and we know that there is a growing body of research on increased stress hormone levels, not just in pregnant women, but especially in women broadly after and during extreme events. And those are likely to have both direct physiological influences too.
Yeah. And this reminds me, many of the relationships you talked about actually with women remind me of what we've seen in the pandemic as well, that these things may exist for women, but they certainly have been emphasized. The lack of care, for example, for cancer patients their chemotherapy in some cases was halted. So long-term effects, even from that exposure to the pandemic, I'm sure that what you're showing has relatively similar effects with the climate change effects of things like those natural disasters.
Yeah, I'm sure that's true. In fact, a number of people are treating the lockdowns related to the pandemic as sort of a model to understand other impacts from extreme weather. Now, we're focused a lot on extreme weather because we're looking at that right now, and the events are so dramatic, and the easier to study.
Yeah, easier to study. I think it's probably true.
But the long-term effects of climate change on our ability to produce food and feed people healthy food is, receiving some attention. Very hard to study. It involves a lot of modeling. But it is likely that changes in rainfall patterns, extreme heat. There's also really interesting work going on the increases in ambient CO2 on the nutritional quality of crop plants. So a very direct effect, not of climate, but of a climate driver on nutritional quality of foodstuffs. So yeah, the complexity is overwhelming, but I think those long-term effects will be as important and require us to look at them in the context of our economic developmental processes as well. How we adjust, how we change our agricultural systems, how we change the where and the way we live, and whether poverty continues on the path it has been for several decades of decreasing on average around the world. Most people think that between the climate and the pandemic, we have really interrupted and perhaps even reversed decades of change in that sort of fundamental underlying feature of poverty, vulnerability.
Mhm. Yeah, yeah, please do.
What is your time frame that agency-wide involvement with this new initiative? Do you have a time frame established in terms of reporting out or development of subcommittees, or how exactly are you approaching that as part of your activity as a steering committee?
Did you hear that, Dr.
I
Rosenthal?
think so, yeah. Well, we have near, medium, and sort of long-term goals. We have regular reporting to the White House and to Congress and to many places. So we're always reporting to somebody. It's part of being a government agency. We, as I said, budget and to a certain extent staff time and all the machinery that needs to process a lot of these things at a large agency regulates some of what we do, but budget's a major factor. But we've already issued several calls, and we have in the design press, and we expect those calls to be at an open-ended notice of interest for the regular grants programs from many institutes in this area. Our long-term goals are more strategic rather than narrowly defined objectives. We want to see progress in many areas and a deeper understanding of them. We are thinking part of our plan is to develop a global network of centers of excellence. And there are many different forms and just conversations about that going on now. Those would be in the US and around the world. That requires a substantial infusion of money that we are actively pursuing and wherever we can, and then also demonstrating to Congress that we can use it well. I hope that's kind of what you were getting at.
This one back there, Rika, can you?
So thank you so much for a very informative presentation. You've laid out such a great blueprint for action. Just thinking about the political determinants of health. We live in a time of an epidemic of disinformation, right? That's a concern and an issue. Many who don't even believe the evidence. Thinking about women's role in leadership positions, do you know of any evidence that has looked at women who are in leadership positions, if there's any correlation between adoption of climate-friendly policies?
That's a great question, and it comes up all the time. And this is a regular statement made by several of the UN agencies and several partners. I haven't seen those sort of academically validated works yet. It's intuitively makes sense, and I can point to individual examples where this is the case. And Mary Robinson, one of the chief spokespersons around the world for climate action, who's the former president of Ireland, says this all the time, that removing the barriers to women in leadership positions is one of the single greatest things we can do to support climate action. Like I did with greenness, I sort of accept that intuitively, but I'd like to see the evidence before I, speak to it as a scientist.
Yeah, thank you for your presentation. I would be very much interested in your statement about the 3 most challenging health issues for women. If I go back in history, let's say in the 60s, there was drug safety, contraband. In the 80s, 90s, was breast cancer or endometriosis. So you touched on a lot of items, but what would you define as the 3 most challenging and needed support in women's health?
I think I heard that. The audio was not great. The 3 greatest challenges to women's health from climate change, is that the question?
No, in general, not from climate.
He's trying to pull you out of climate change. In general, women's health. 3 greatest challenges. I don't know if you want,
Yeah,
currently.
I have to be honest, I would probably be speaking above my pay grade or my expertise to go there. I'm an environmental health scientist, but clearly, yeah, I'm just going to let it go and focus on climate change. In the climate space, I think access to care and all the associated vulnerabilities are profoundly threatened by climate change. I think poverty and malnutrition around the world are extremely that women are biased toward women, if you will, or against women. I can speak both from personal experience and also from research papers that show that, in developing countries, especially, and perhaps often when food is scarce, women feed their children and their husbands first. Actually, the husbands first, then the children, and then themselves. And very often that has an enormous input. The other thing to keep in mind in the context of climate change is that around the world, women are at least half, if not more, of the agricultural workforce, especially in low to middle income countries. So women are experiencing day-to-day extremes of weather and especially high heat. So that poses a particular vulnerability to them. I'm sorry, I'm not going to the heart of your question. I'm speaking at the margins.
One more question on the online from Zoe Taylor. Great talk and super interesting on health threats due to climate change. I wonder if you could also speak to how these threats will be linked to global migration and displacement and health implications from these intersecting crises.
Yeah, hugely important question. And thank you for raising that. I didn't spend any time on that, but it is a huge issue. We are already seeing migration related to climate change all over the world, related to droughts, and particularly the associated impacts on ability to achieve livelihoods, for farming communities, but also extreme weather and the disruptions of people's homes and the loss that sends people fleeing. There are refugee camps in several parts of Africa that are now struggling with a brand new sort of social ecosystem that in some cases is not temporary. We call them, think about them as temporary areas, but a lot of them are now permanent. So there are, little to no clinical or medical resources available, or they're primitive, and this is a big challenge. Access to fuel for cooking, access to clean food. So all those make climate refugees especially vulnerable. And then you get into the more complicated sort of political effects of migration that creates real risks just to travel. And all of you have read about the loss of life on shipping and underground trafficking, as well as what that does to the political discussion in receiving countries. Pretty complicated area and really important, and climate is a major driver. So that the access issues and the health issues, particularly those with chronic diseases, are going to be already especially important. There's a lot of research now a growing body of research on how you do implementation science. That is, how you deliver care and deliver it effectively with known interventions, but in refugee settings, in an area that I would encourage others to look at carefully.
Thank you very much, Dr. Rosenthal. I really appreciate your presentation. It was really informative and very interesting and very timely, obviously. So I think we'll call the questions at this point. And I really appreciate your spending your time with us today. And I think our audience also appreciates it. Please join me in thanking Dr. Rosenthal.
Thank you very much. And it was a real pleasure.